All right, hi everyone. This is Mrs. Heimovitz. We're doing activity 2, bone dissection. So for this station, you are going to watch a dissection of a bone. Please read the information below to help you complete this station. So what we're looking at is a section sawed from a long bone from a cow, probably the femur or the humerus. The long bones store fat, which is the yellow marrow. It has a low melting point, so your sections may be greasy. Use a paper towel, wipe it clean. So this is what we're looking at here. Okay. If you look at it, you can see that it's shiny looking. Okay. Inside here, this is some of the yellow marrow. If you notice, as I push it down, it's kind of squishy. If you can see a little indentation, there we go. A nice indentation there. But that is our yellow marrow that we're looking at here. Okay. All right, so our directions say, using forceps, rip off a piece of the periosteum from the outer surface of the bone. So we're going to look here at the bone. On the outer surface, we have this thick, fibery tissue here. This is our periosteum. So the periosteum is very, very fibrous. As I pull on that, I hope you can see all the fibers that are there. It has a lot of collagen present. The periosteum is the outer covering of the bone. This is where the blood vessels, the nerves, the lymph vessels, they're all going to attach here and then work their way through the actual bone tissue. Okay. So this is our periosteum. So I'll rip off some of that. It's lovely. So gross. So let's see if I can get a good chunk off over here. All right. All right, so there's some of that. So hopefully you can at least see how it's coming off. Not very well, but it is, here, let's see. It is coming off. Get underneath of that. Keep working on that.
It's very fibrous.
It is, yes. It's really hard to get off.
Well, which would be a good thing since it's carrying the nerves and the blood vessels.
Right, it's good protection for, I'm going to stab my finger.
Be careful.
All right. I don't know if you guys can, if this is showing up good.
Oh, yeah.
Okay. So hopefully you can see here. Here is the bone on the underneath, and then here's your periosteum on the outside. Okay. All right, so there's that. All right. No, you're going to have to wait. All right, so what, okay. You may even find, wait, hold on. The fibrous nature of the periosteum can be seen with the naked eye. You may even find fragments of tendons, ligaments, or muscles still attached to the bone you are dissecting. So we do have some attachment down here. This looks like it might be, it's either a ligament or a muscle. It's kind of hard to tell exactly what we're looking at. But it's definitely something here attached down here. All right. Using your probe and fingers, wearing gloves, compare the texture of the cortical bone and the trabecular bone. All right, so this one here, if you look, this type of bone has a lot more, a lot of cortical bone in it. Okay, so here along the outside where my fingers are tracing, this is the cortical bone. This is the dense bone here on the outside. Okay, if you look at it, there's not a lot of space here. It is rough as I feel it from where it was sawed. But you can look in that bone and you don't see a lot of space or open area. Okay. I will have to show you the trabecular bone on another section. So I'm going to get that. Can we pause this? I can deal with this class. Okay.